Hello, my name is Antoinette Salter, and I will be speaking with you today on billing errors in healthcare and how to prevent mistakes. Healthcare is designed to enhance patient care. Proper procedures must be followed by medical professionals. Medical professionals must avoid mistakes such as claim denials, errors in documentation, and choosing the correct CPT procedure code. Patient privacy must be followed in healthcare. The correct information must be documented from the patient. The reason why is so the patient will not receive a bill in the mail. This should not happen if the patient has insurance. If a patient demographics or insurance is not properly charted, the medical billing department will have a hard time in helping the doctor receive payment for services. If a patient was in the ER for self-harm, or there is no history of documentation or keywords, this claim can result in a denial. A patient doesn't want to experience false treatment or be misdiagnosed. A patient's life might depend on the quality of treatment and being able to live a healthy life. So I have here my visual aid. And my visual aid is a CPT Coding 2021 coding book here. Okay. And I also have my ICD-10 procedure coding book, my 2021. And that includes my visual aid. Okay. And so, also neglect from a dentist. This occurs when a dentist fails to diagnose an issue from the patient, which is considered dental malpractice. For an example, a result is due to incorrect diagnosis on a patient, which can lead to a patient having a bad effect on their health. If a patient signs a consent form, the medical professional is not allowed to provide any information to a family member or an attorney. This means the patient has the right to their own privacy. So I have a couple of quotes here. Accordingly to Barbara Gabella and Beth Helm from Hillsberg in Germany on June of 2022 states, these reviewers assessed physicians' documentation, self-harm keywords that support the assignment of any initial self-harm ICD-10 code. This means is medical records must be reviewed carefully and keywords must be stated for billing purposes. Also, I have another quote here that is interesting to my topic. Accordingly to Galen Alexander and Joseph Helm, which are physicians from New York, on December the 1st of 2020 states, patients' encounters are billed by applying a complex of rules. So for an example, this means to my topic is medical billers and coders must code to the highest diagnosis. Also, I have another quote that's interesting to me. Accordingly to N&J, the medical marketing and media from New York on June of 2022 states, what we need to do was move to a mix of omni-channel tactics. This means there are ways to deliver good customer service to patients. Yes, it is. Accordingly to Rebecca Karam and Mathis Lucas from the International Journal of Environmental Research and Public Health, and the winter of 2022 states demographic and clinical parameters were collected by reviewing electronic medical records. This means medical billers must have all correct information from the insurance to correctly code and bill. Another quote here I have: according to Healthcare Executive and Board of Governors from California on May of 2022 states, patients has the right to request and obtain an accounting of these disclosures under HIPAA law or state legislation. For an example, patient has the right to take legal action if they feel as though their information is not secure. So my final thoughts I have for you today: all medical professionals such as nurses, physician assistants must slow down and breathe to avoid making mistakes. Also, patient representatives is receiving the correct information. It must be clearly documented at all times. So I also have an option on how to prevent mistakes. I think training can help to avoid billing errors, and also active communication with the team and doctors so that services can be coded correctly. Know your department styles of learning. This can reduce medical errors. And so that concludes my presentation on today. And thank you so much for your time. Have a good night.